There's something seriously more dangerous about the COVID virus than was previously thought, and it's only just becoming apparent. Italian doctors and researchers are increasingly concerned that there's been a huge underestimation of the sheer severity of COVID-19. These are not coronavirus patients, but in this region there is a spike in psychosis, kidney disease, spinal infections, strokes, chronic tiredness and mobility issues. The virus inflames all the organs in the body, putting everyone at risk still. Dr. Roberto Cosentini oversaw the emergency response in Bergamo, one of the worst affected towns in the north of the country. He's concerned there will be another COVID surge here on top of the ongoing damage to survivors.
Subsequently, we discovered that it is a systemic illness with vessel damage in the whole body, with renal involvement, cerebral involvement, and so we've seen other acute manifestations, acute renal failure that requested dialysis or stroke, and then acute myocardial infarction. So we saw a lot of complications of our manifestations of the virus. And also now we see a significant proportion of the population with chronic damage from the virus.
Bravissimo, bravo. Hai dolore?
The pandemic that swept through these hospitals created an almost unique environment where doctors and experts in different fields found themselves working together for months, effectively learning new skills.
Come va?
Dr. Emanuela Catenacci is a neurologist who was co-opted to work on the intensive care wards. She's now back on neurology. Crucially, whereas in the past she would have treated her patients completely independent of other departments, now she can see the link. And that link is COVID. It's a multi-organ killer.
The virus is a systemic infection. Some of our apparatus organs had the biggest manifestations, such lungs, as we know, but also brain, skin, and sometimes we have vasculitis. So it's not so high respiratory or low respiratory infectious. It's not finished that.
Here, all COVID victims are being constantly monitored and tested. They're trying to gauge the long-term effects of the disease. They're beginning to fear that some may never recover. Filippo Alcaini has been COVID-free for 4 months, but he still struggles to breathe or live a normal life.
E dopo a quelli che invece non rispettano niente le auguro una settimana che ho provato io. Una bella settimana di star male come sono stato male io, che forse capiscono di non sottovalutare tanti aspetti che dobbiamo per forza obbedire e stare ai ripari.
It seems that the coronavirus may appear to calm down or at least continue in waves, but it is ongoing. It's a worldwide disaster still. What the doctors here are saying is that people must listen. They are seeing people who had mild COVID symptoms coming into hospital with serious illnesses that might stay with them for the rest of their lives. And once again, they're emphasising you must wash your hands, you must keep up social distancing, and you must wear a mask.
Buongiorno Giordano, buongiorno.
The hospital wards in Lombardy, the worst hit area in Italy, are quiet now. But the long-term effects of the virus on society is ongoing. A second wave remains a possibility, but the effects of the first wave go on. Stuart Ramsey, Sky News, Lombardy.